In the quiet corners of our homes, where memories hang on the walls and laughter echoes in the air, there's a story unfolding. A story that intertwines love, loss, and the unspoken challenges of a condition that silently affects millions. Welcome to the Cause and Effect channel, where we unravel the complex threads of life's most pressing issues. Today, we dive deep into a condition that touches most of us, yet remains shrouded in mystery and misconception: dementia. It's not just a story of memory loss, it's a tale of its economic impact and the profound cost it exacts on individuals, families, and societies. Imagine the confusion, the disorientation, and the fear that engulfs someone who can't remember their name or the faces of their loved ones. This is the chilling reality for millions of people around the globe living with dementia. A condition that robs individuals of their memories, their identities, and ultimately their independence. Picture a typical middle-class family, the Williams. They're just like any other family, bound by love, shared memories, and dreams for the future. But their lives took an unexpected turn when their matriarch, the pillar of their family, developed early-onset Alzheimer's. The diagnosis was a shock, a cruel twist of fate that upended their lives. The woman who once held the family together, the one who remembered every birthday and every anniversary, was slowly slipping away. And as her memory faded, so did the family's financial stability. The cost of care for Alzheimer's is staggering. It's not just the medical bills, the medication, and the doctor's fees. It's the round-the-clock care, the home modifications, and the loss of income as family members give up their jobs to become full-time caregivers. For the Williams, like many families, the emotional toll was heartbreaking, but the financial strain was devastating. The Williams story is not unique. It's a tale shared by millions of families worldwide who are grappling with the economic impact of dementia. It's a story of families who are forced to make tough choices, who have to prioritize medical care over education, mortgage payments over retirement savings. It's a story of families who face the prospect of financial ruin even as they watch their loved ones fade away. It's a story that underscores the urgent need for societal and policy changes, for healthcare systems that are better equipped to manage the economic burden of dementia, for financial support systems that can provide respite to families like the Williams. The burden of dementia extends far beyond the emotional pain. It has a profound economic impact on families and societies. And as we continue this journey, let's remember the weight of memory loss and the cost it exacts not just on the individuals affected, but on the very fabric of our societies. Taking care of a loved one with dementia is like having a full-time job that you pay for instead of getting paid. Imagine, if you will, a toll gate. Now, instead of a car, imagine it's your life. And each time you pass through, you're paying with your time, your energy, and your resources. That's dementia care in a nutshell. The costs associated with dementia care are multifaceted and often staggering. It's not just about the medication, which can run into thousands of dollars every year. It's also about the home care, the hospital stays, the therapy sessions, and the list goes on. Home care, for instance, is no small expense. Professional caregivers can charge upwards of $20 an hour. For a full-time caregiver, that's nearly $170,000 per year. Add to that the cost of specialized medical equipment and home modifications to ensure safety, and the figures only climb higher. Hospital stays. They're not cheap either. A single day in the hospital can cost up to $3,000, and that's without any specialized procedures or treatments. Then there's the cost of lost income. When a family member becomes a caregiver, they often have to cut back on work or leave their job entirely. The economic impact here is twofold. There's the loss of the caregiver's income, and there's the loss of their potential future earnings. And let's not forget the emotional toll. The stress, the sleepless nights, the worry. Can you really put a price on that? The financial strain of dementia care is a heavy burden that many families bear. It forces them to make sacrifices, to make tough choices. Do they buy medication or pay the mortgage? Do they hire a caregiver or save for their child's education? The cost of dementia care is not just a family issue, it's a societal issue. It's an issue that affects us all, whether we realize it or not. And it's an issue that we need to address for the sake of those living with dementia, for their families, and for our future. In a world where we are living longer, are we prepared for the rising tide of dementia? Indeed, the cost of dementia isn't merely a personal or familial burden, it's a societal challenge, a tidal wave that threatens to overwhelm our healthcare systems and economies. As we grapple with the economic implications of dementia, we must also consider the policy implications and the role of our governments in this unfolding narrative. Governments, after all, set the stage upon which the drama of dementia plays out. They shape the policies that determine how we care for those who can no longer remember, how we support their families, and how we fund research into this insidious condition. Yet are these policies sufficient? Are they comprehensive, inclusive, and forward-thinking enough to meet the escalating challenges posed by the cost of dementia? Let's consider this. Current policies often focus on the medical aspects of dementia, overlooking the broader social, economic, and emotional impacts. They may fail to address the needs of caregivers who often bear the brunt of the emotional and financial strain. Is it enough to fund research and treatments, or do we need policies that also support the human beings tangled in the web of fading memory? Moreover, these policies can be a maze of complexity, difficult for families to navigate when they are already grappling with the realities of a dementia diagnosis. The burden of bureaucracy can add to the cost of forgetfulness in terms of time, money, and emotional stress. And what of funding? Are our governments investing enough in dementia research, in care facilities, in support services? Are they prioritizing this issue, or is it lost amidst other competing concerns? The role of government in addressing the cost of dementia is pivotal. It is only through comprehensive, compassionate, and forward-thinking policies that we can hope to mitigate the economic impact of dementia. We need policies that look beyond the immediate and consider the long-term ramifications of a world where dementia is increasingly the norm. We must ask ourselves, are our policies equipped to handle the cost of memory loss? As we grapple with the economic burden of dementia, we must explore all avenues of support. The financial toll of dementia is immense, and it's a cost that's borne not just by individuals, but by families and communities as well. To navigate this landscape, it's crucial to understand the support systems that are in place, and those that are yet to be. Insurance, for instance, is a cornerstone of financial support. It can cushion the blow of high healthcare costs, but it's a safety net with holes. Not all policies cover dementia care, and those that do may only provide partial coverage. The reality is, insurance can be a complex maze, leaving many families feeling lost and overwhelmed. Government programs offer another source of support. In many countries, state-funded healthcare systems and social services can help to offset the cost of care. Yet, these programs often come with their own set of challenges. Eligibility criteria can be stringent, resources may be limited, and wait times can be long. And then there are charities and non-profit organizations. These groups do remarkable work, providing financial aid, respite care, and essential resources for families. They fill gaps left by insurance and government programs. But they too are stretched thin, reliant on donations and volunteers to keep their services running. But let's not forget about the role of communities, neighbors helping neighbors, friends supporting friends. These informal networks of support can be just as vital as formal systems. They may not provide financial aid in the traditional sense, but they offer something equally valuable: time, care, and a shoulder to lean on. Yet despite these supports, the financial burden of dementia remains a daunting challenge. There are gaps in the system, cracks through which too many families fall. We need more comprehensive insurance policies, more accessible government programs, and more sustainable funding for charities. We need a system that doesn't just react to the cost of dementia, but actively works to reduce it. Financial support systems are a lifeline for many, but are they enough? As we look to the future, this is the question we must grapple with, the challenge we must rise to meet. The cost of fading memory is not just in dollars and cents, but in the lives it changes forever. This is a truth we've been unraveling throughout this discourse, a reality that millions around the globe grapple with each day. Dementia, the insidious thief of memories, affects not only those who have been diagnosed, but also the individuals around them. The personal toll is immense, almost immeasurable. Picture a loved one, someone who has been a pillar in your life, slowly fading away. The essence of who they are, their memories, their experiences, their personality, gradually erased. It's a heart-rending spectacle, a silent tragedy played out in homes and care facilities worldwide. And this personal cost is echoed in the economic burden that dementia places on families and societies. The financial strain of care, the lost productivity, the impact on healthcare systems. These are serious considerations that demand our attention. It's a price tag that continues to escalate with no sign of reprieve. But beyond the financial implications, there's a broader societal impact to consider. The ripple effects of dementia are far-reaching, touching every corner of our communities. The strain on medical professionals, the shift in family dynamics, the need for increased community support, all these factors contribute to a societal shift, a change in the fabric of our everyday lives. In the face of such a daunting reality, it's easy to feel overwhelmed, to feel as if the cost of forgetfulness is too high a price to pay. But remember, while the cost is immense, so too is our capacity for resilience, for innovation, for compassion. We're not powerless in this fight. With continued research, with policy changes, with increased support for those affected and their families, we can make a difference. We can lessen the burden, ease the cost, and most importantly, we can offer hope. In a world where we value memories so much, how do we measure the cost of dementia? Perhaps the answer lies not in the cost, but in the value of our response. It's a question that invites not just contemplation, but action. Let us rise to the challenge. As we've seen, dementia is not just a personal tragedy, but a societal challenge. This statement rings true as we've explored the multifaceted impact of dementia on individuals, families and societies. The economic toll is staggering, with the cost of care and lost productivity placing a significant burden on families and healthcare systems. The emotional cost, too, is immense, as we see loved ones gradually lose their memories and identities. But as we understand the enormity of this issue, we also recognize the urgency for comprehensive policies, robust financial support systems, and societal changes to address it. It's not just about providing care and support for those diagnosed with dementia, but also about easing the burden on their families and caregivers. It's about creating a society that understands, empathizes, and takes action. Let's not forget those who are forgetting. Let's rise to the challenge and make a difference. We have the capacity for resilience, for innovation, for compassion. With continued research, with policy changes, with increased support for those affected and their families, we can make a difference. We can lessen the burden, ease the cost, and offer hope. The cost of oblivion is high, but the price of inaction is even higher. It's a call to action for all of us. Let's act now. Let's remember for those who can't. Let's fight to turn the tide against dementia, and together we can change the narrative of loss of memory. If you found this video informative and helpful, please give it a like and subscribe to our channel. This isn't just about increasing our reach, it's about spreading awareness, educating more people about the harsh realities of dementia, and inspiring them to take action. By sharing this video with your family, friends, and loved ones, you're not only helping to disseminate important information, but you're also contributing to the larger conversation about dementia. This fight is a collective effort, and every share, every like, every subscription counts. Your involvement can make a real difference. So let's stand together in this fight against dementia. Remember to like, subscribe, and share this video. Together we can change the narrative of dementia. Thank you for your support.